Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Hantavirus versus Lassa virus. When you talk of hantavirus, you will remember the recent encounter, and I think it's still ongoing, the experience in the USA, where some deaths were recorded, these ship on voyage. And you can now come to realize that people who are gathered in close proximity are likely to transfer certain infection or problems. That's why the epidemiologists will first of all look for the index, the first person to have it, and then his contact. That close proximity, we share not only knowledge and all the things, but we also share diseases. And antivirus is one of these agents of destruction, more or less, because when you look at them, they are so tiny, you cannot see it with your naked eyes, no matter how they have been great, but you can see the damages that they do, which we see as signs and symptoms. And then once that is treated, that is the area of specialization of medical laboratory scientists, identifying the causative agent of those diseases, signs and symptoms that is so worrisome. Then we have Lassa virus, which is very common in West Africa, Nigeria in particular, because that it's a place in Nigeria that it was discovered. And you look at what is common between the two of them. The Lassa virus is zoonotic, that is transferred from rodents. The same thing, the Hantavirus is transferred from rodents. So what the hantavirus will cause is easy, because it can be transferred from transmitted from human to human, whereas the Lassa virus is usually through the droplets of that rat that is having so many mammary glands. But the problem is strictly what they cause. Hantavirus, though it does not spread quickly, but it could cause death quickly, as experienced recently. The same Lassa virus, on the other hand, too, could cause death, but its damages is hemorrhagic fever. The presentation of both are almost the same, and that's where you now need the slide section to really be able to compare and contrast what these viruses do. Like I've always been saying, the area of concern is always what the medical laboratory scientist role will be, and that is after the clinical diagnosis. Because in a gathering of people and somebody dies or somebody develops flu-like disease or sickness or what have you, and you now want to know what is the cause, that is when you need the medical laboratory scientist to now do the confirmatory tests that will bring out the causative agent. And usually, with the last experience that we know of antivirus, without the laboratory, there would not be any confirmation that it is antivirus and there's a species, and there's a virus species. As we go into the slide session, I will expose more, so that when we see things happening, we can, in our own way, be able to say, let this person be taken promptly to the hospital, because antivirus is a problem that could cause death quickly. Ditto Lassa virus, it could also be transmitted. The two of them could be transmitted to the caregivers, those who are giving care, laboratory personnel, the nurses, the doctors, just name them, as long as they are involved in this caregiving, they could also be infected and also be carriers, transmitting it to others. So let's go into the slide section and get more. The outline: objective, introduction, comparison, complications, laboratory diagnosis, prevention, and control. The objective: to create more awareness of zoonotic infections by comparing hantavirus and Lassa virus characteristics, their complications, exposing their laboratory diagnosis, and the preventive measures necessary to control them. The introduction: hantavirus represents several groups of RNA-containing viruses that are members of the virus family of Fungi that are carried by rodents and can cause severe respiratory infection termed hantavirus pulmonary syndrome (HPS) and hemorrhagic fever with renal syndrome. HPS is found mainly in the Americas, Canada, US, Argentina. That is where the people involved in the recent hantavirus problem were coming from. Brazil, Chile, Panama, and others, while HFRC is found mainly in Russia, China, and Korea. On the other hand, Lassa virus is an RNA envelope virus, a member of the RNA virus family that causes Lassa fever, an acute viral hemorrhagic illness like Ebola virus. Is carried by multivariate rats of the genus Mastomyces and is Mastomyces natalensis, and drops in urine and compost. These are where the virus reside. The virus can be transmitted by direct contact with this material and also through the aerosols release. It takes 1 to 3 weeks incubation from where you see the symptoms and the signs and symptoms. Now to the comparison. When you look at the features, you talk of Lassa virus fever and hantavirus. The viral family, I've earlier mentioned it, Arena and Bonia. The primary reservoir is the Lassa virus. You find it in Mastomyces natalensis, and these hantavirus, you find it in rats, rodents, and even in deer and mice. The endemic region where you find it main is for Lassa, West Africa, while the hantavirus is worldwide, the Americas to be specific. Primary system affected: the Lassa virus affects all vascular, so that's why it could cause that hemorrhagic problem, bleeding, because the vessel will carry this virus to every organ, and there you can notice even the kidney damage. The same thing is almost happening with hantavirus. It affects the lungs, the kidney also, and that kidney damage is a serious one with hantavirus. The human-to-human transfer is possible and it's happened often in Lassa fever. The Andes strain of hantavirus is very common, the human-to-human transfer. The laboratory diagnosis. So, considering the recent hantavirus case, let's look at the case 1 of it. An adult male developed symptom of fever during that voyage, with headache and mild diarrhea on 6th April 2026, while on board the ship. By 11th April, the case developed respiratory distress and he died on board on the same day. So no microbiological tests were performed. The body of the passenger was removed from the vessel to St. Helena, a British overseas territory, on 24 April. So that is where you can then understand the area of laboratory investigation because it's not done in that sheep. It's not done on the land. And the diagnosing hantavirus during a voyage relies on an initial assessment of the flu-like symptoms. So the travel history and potential rodent exposure followed by specialized lab tests such as CDC serologic blood tests that detects specific IgM antibodies. Then the right time PCR to detect viral RNA in blood samples. So you now find a way, a transport system to send it to the lab on the ground. And that way, this quick diagnosis will be done in the acute stage. The IgM is what is expected during the acute stage of any infection. Then other tests that could be done is the AST and other coagulation studies and LFT. Now, finally, we are talking of prevention and control. Speaking from the recent hantavirus experience, we must be vigilant. Vigilance amongst travelers because it's a voyage. You have close contacts. One can easily be infected. So that vigilance is necessary. The crew, including those involved in implementing ship sanitation measures or other personnel returning from areas where hantavirus is known to be present, as well as on conveyances, engage in ecotourism on a journey from and through those areas. Like in this case, Argentina is a corporate country. It's essential. And since the Lassa virus and hantavirus are enveloped, they are easily destroyed by detergents. And hygiene is when you wash your hands very regularly, is very important in removing these pathogens, these viruses. Environmental cleaning and safe handling of blood and body fluids are highly recommended. In addition to standard precaution, transmission-based precautions should be implemented for the management of suspects or confirmed cases. Standard precautions combined with transmission-based precaution during close contact are considered sufficient. For aerosols generating procedure, airborne precaution should be used. When pulmonary syndrome is concerned, especially caused by this Andes virus strain, is suspected, patients should be promptly transferred to an emergency department or intensive care unit for close monitoring and supportive management because you can see the speed at which that case one experience happened. Very quick. Antiviral drug ribavirin is recommended for Lassa virus treatment. It's been very successful. For prevention of Lassa fever, isolating infected patients from contact with unprotected person until the disease has run its course, putting food away in rodent-proof containers, and keeping the home clean help in discourage rodents from entering homes. Transmission of the Lassa virus from rodents to humans can be prevented by avoiding contact with mastomyces rodents, natanensis. Trapping in and around homes can help reduce rodent population using infection control measures such as complete equipment sterilization, wearing protective clothing such as masks, gloves, gown, and goggles when caring for patients. That is when the healthcare givers are concerned with Lassa fevers. And then the healthcare givers personnel must try as much as possible to avoid any secretions from these patients. I've always been saying there are so many videos in this my channel on health matters, especially the role of the medical laboratory scientists. Thank you.